The World Heart Federation, post the UN Summit on Non-Communicable Diseases, wanted to take an issue that we felt really had not been addressed yet, and yet that would be of increasing importance. And that was the issue of children living in cities and how that was exposing them to lifestyles that were not heart healthy, and in fact how children increasingly will be having high risk factors for heart disease as a result of living in low and middle income countries, in cities in low and middle income countries. The drivers were the recognition that that more and more people live in cities, that whereas in the last century most people lived not in city environments, in more rural settings, the majority of the world's population will be living in large urban areas. Many of those cities are being developed without any thought to the implications of physical inactivity and physical limitations that they impose on their populations. So most people live in these large mega cities in Asia and Africa and elsewhere, cities with populations of 10 million or more, and yet very little in the way of access to open space, safe places for physical activity, very heavy traffic, poorly planned places. We felt that in particular children were growing up in these cities with very little in the way of access to physical activity or good food, and a lot of exposure to, for example, tobacco smoke. We know that, that much of what we know about cardiovascular disease is actually decided in childhood. Some say that cardiovascular disease is the adult manifestation of a series of exposures in childhood, and we really wanted to draw attention to that fact, to the fact that CVD is actually a children's issue. At the same time, there's also rheumatic heart disease and other heart diseases that that really do affect children in poor urban settings in particular, and so we wanted to show the focus on those twin tracks of children being either having heart disease at early ages in the case of rheumatic heart disease, or being exposed to, at very early and accelerated paces, to the factors that lead to later presentation of CVD. The outcomes of the report commissioned by the World Heart Federation showed that while there's much convincing evidence that children's heart health is placed at risk by the way they're growing up in large urban settings in low and middle income countries, there's actually much that can be done in terms of policies that are implemented at the city level. It's much easier to implement a policy in an urban environment than it is at the national level, and much easier to foster the type of collaboration that's necessary to ensure those policies are fully implemented. One of the recommendations of the report is something which we're calling the SPACE initiative. SPACE is an acronym for Stakeholder Collaboration, Planning Cities, Access to Healthcare, Child-Focused Dialogue, and Evaluation. So we want to ensure that that stakeholders are all at the table, and that cities are planned with ample physical space to ensure that children can move about safely and get all the exercise they need. Access to healthcare to ensure that they have the full access to health systems that fully treat children as effectively as possible. Child-focused planning and evaluation. One of the reasons that we chose the SPACE initiative, that we chose to focus on children and urbanization and heart health, is because we felt it's an area that has great potential, but is also in need of much more research to show how cities can be places that either hinder heart health or help heart health. So we really hope that in introducing the SPACE concept in our discussions and in our public communications, we can encourage researchers to take on this issue and to address different aspects of it, and that can form the basis for policy change.